Good morning, everyone, and good morning also to anyone watching online. We have a very amazing array of officers here, so I think before we start, if we could just do some introductions, would that be possible, so that everyone knows who you are? Thank you.
Good morning, I'm Hazel Webb, I'm Head of Stronger Communities. I'm here on behalf of Kerry Pennell, the Assistant Director for Communities and Leisure.
Good morning, I'm Julie Cardwell, Head of Leisure Services.
Morning, I'm Anne Delay, Public Health Practitioner for Mental Health and Suicide Prevention.
Good morning, Holly Koenig, Public Health Practitioner for Smoking and Vaping and Weight Management.
Morning everyone, Amit Gaukar, Public Health Principal for Substance Misuse and Mental Health. Thank you.
Morning, my name's Lee Bell. I'm a Public Health Consultant working in the Public Health team and covering quite a lot of the presentations today.
Morning, Shirley Plenderleith, Assistant Director for Public Health.
Morning, Councillor Jill Mercer, Chairman.
Morning everyone, David Watts, I'm the Executive Director for Adults, Health Partnerships and Housing.
Morning, I'm Pauline Brennan, I'm the Administrator for this particular panel.
Good morning, Councillor Paul Marks, Windmill Ward.
Good morning, Patsy Richards, Public Health Principal for North Northants Council.
Good morning, Councillor John McGee from Kingsford and Corbett.
Thank you very much, everybody. The first item on the agenda is apologies for absence.
Chair, apologies from Councillors Howell, Shacklock and Roberts this morning.
Thank you very much. Okay. Minutes of the meeting held on the 29th of November, which you've been sent. Is everyone content that they are correct record? Okay, thank you. Okay, so substantive item is the health and wellbeing strategy, and it's a really exciting piece of work to really push public health out into the community to help with inequalities in health. And although there is the actual strategy which you've just been given a copy of, there's also the delivery plans that sit behind it. So it's not just a piece of paper that you put on the shelf and then it's forgotten about. So I'd like to, for Shirley, to start us off with going through the presentation to explain the different strands.
Thank you, Chair. As Councillor Mercer said, you will have seen a copy of the Health and Wellbeing Board strategy, but what we're really excited to talk to you today about are the development and delivery plans. So I will just do a short introduction, and then we have a series of subject matter experts and leads to talk to their development plans, which are, as you will understand, are in different stages of delivery, which is why we wanted to have this conversation this morning about input from yourselves and some support and guidance. So if I just quickly set the scene. So, as I said, it's the focus on the development plans today, and each workstream lead will introduce their area, and then we want to have the questions and discussion at the end. So the background is the strategy itself, 24-29, the system strategy was agreed by the board on the 12th of December. There are 5 key priorities, and they each have an executive sponsor and a workstream lead and specific public health support to implement the activity. In addition to that, Public Health have set aside £750,000 to support the implementation and some innovation in the implementation of the priority actions. That's for the lifetime of the strategy, but we anticipate that that will be spent in the first 3 years with test and learn, so that we can understand what works and what doesn't work. A new strategy oversight group has been set up that reports through the Place Board into the Health and Wellbeing Board, and that tracks and monitors activity and delivery and progress. The development plans themselves are going to be published as they are built out on the Health and Wellbeing Board website. The development plans will be iterative and active, so if we find things that aren't working, we will refresh plans. If we find things that are working, we will harness that activity and make sure that we're taking that approach. So the priorities are listed below, the 5 key priorities, and these are the executive sponsors. And I think I wanted to share that or draw that out from the strategy so that members understood it wasn't just a Northamptonshire led activity. This is across the system, and there's real buy-in and real enthusiasm to tackle these issues: smoking and vaping, keeping active, mental health and wellbeing, looking at children and young people, and addressing financial resilience in our most vulnerable population. So we have a broad range of partners who are leading on those. So just to refresh your memories, this is what we're looking at this morning. We just want to understand how you can help us connect better to local communities, because we feel that that's a skill set that you have that we can perhaps harness to ensure that these priorities are progressed and addressed as much as possible, and we maximise impact in the 5 years. We just wanted to talk about any specific groups when you've heard the presentations, whether you think we should be linking with. And for those action plans that are in the very early stages, so the children and young people, mental health and financial resilience, are the specific approaches that you think we should be building in that will, as I say, maximise impact? So just keep those questions in your mind as you hear the presentations, and then we'll return to those at the end. So I'm going to hand over to Lee to lead us and start the first presentation. Thank you.
Hello. As you might notice up there, the programme lead is Pippa, who is my colleague within public health, but Pippa's not able to come today, so I'm speaking to her slides. So I do apologise if there's some stilted moments where I'm looking at the slide thinking I can't remember what I'm talking about. So one of the things that has been developed in this is that we want to look at smoking prevalence and inequalities around smoking prevalence across the locality. This is not just a local initiative, and it's not just a public health initiative. I think it's fair to say that that's been a national programme and an international programme of reducing the harm of smoking, and more recently the harm of, or potential harm of, illegal tobacco and vaping. And it's something that we're all committed to in that strategy. So the objectives of what this approach is looking at is to increase the number of residents supported to stop smoking, and looking at targeting that provision to population groups where we know there's a higher prevalence. So making sure that those groups that have inequalities around smoking and ill health have those targeted approaches. And often that's making sure that people who are in positions where they can't afford the products or the support emotionally to stop smoking have got that available to them as a targeted approach. Also, one of the main things that we're looking at is around smoking and vaping in children and young people. It's a concern for all of us of looking at why that's happening and how we can stop that. And as we know, there's a national approach to this as well that we're taking very seriously in this approach. And also there's been a heck of a lot of work and investment from public health and from our trading standards colleagues around the disruption of sale of illegal tobacco and illegal vaping and e-cigarette products, and specifically looking at underage sales. We've been really clear that that's an area that we want to target. So looking at where we are today, we've been looking at stop smoking services expansion. So additional stop smoking advisors, additional smoking specialists and a team leader within that service. The reason for doing that is to make that service more accessible and enable that targeting that we talked about. We've increased the number of clinic spaces and reduced the service waiting time. So when somebody is requesting input, we're looking at doing that at the right time. So getting that impetus and getting people in straight away. We've commissioned a process internally that allows us to provide those nicotine replacement therapies, e-cigarettes, and things that we know assist people to stop smoking. And we've looked at how we make sure that those actions are communicated to our population. Because it's great having services, but if nobody knows about them, we need to make sure that those targeted communities actually know where that is and that they're easily accessible. We're also looking at specific population groups with higher prevalence. So we've been looking at Corby Local Partnership, looking at, we know that some routine and manual workers will experience this as an inequality. So looking at how do we access those population groups. So working with the right people to access them. Also looking at what are the drivers to smoking in this population group and how we can increase the demand for those people to actually access the services and go on to stop smoking. So we've been looking at the stakeholders in the local partnership. There's a task and finish group, and we've been looking at the data and intelligence that we already have to be able to identify where those population groups are. And we've been looking recently at commissioning how we do that with a supplier, so that we're using community assets and that we're not doing that sort of just in a corner quietly that nobody knows about it. So where we are today, there has been progress on this action plan. It's an iterative process. We're not there yet. I'm not sure that we'll be there quite yet, and we're committed to keeping on going. So there's been guidance developed to support secondary schools around vaping. That's been a really important thing. Schools were asking for that. How do we address this? We've got draft guidance that's been provided for secondary schools, and a lot of consultation with those schools based on their feedback of how we can improve that. And our Healthy Schools team have been looking at the national resources available and looking at the school survey to be able to make sure that we understand our young people. You know, it's great that me as an older person is saying we need to do X and Y, but actually we need to understand those young people to be able to put the right thing at the right place. And a steering group's been set up with the county schools event, and this year that topic is vaping. We've also got projects which are around the illegal sale of tobacco products, including vaping products. There's been a large investment into trading standards and a lot of work in the locality based on intelligence to disrupt that supply. There's been an analytical exercise on the hotspots, so where illegal sales have been reported, actually mapping that out and doing targeted approaches to those areas so that it's not, if it's moving around, we're looking at the area, not just individual premises. So the next stage would be to do test purchasing. Obviously that's based on intelligence, and there's been some meetings between police, trading standards and licensing and public health. So we're working together in a joint approach. It's not a one approach. And our focus this year, there's 4 elements of focus. We've narrowed that down. We're also looking at bringing the team up to full capacity. There's still some vacancies. We're looking at a framework around those stop smoking aids to make sure we've got the most up-to-date products available to our locality. We're looking at our young people, coordinating stakeholder events and bringing young people into those to analyse what it is that we need to do. And we're engaging with our young people in a way that is accessible so that we can make sure that that group is served in the best way. And also looking further down the chain of how do we stop this progressing? How can we get in earlier to make sure people don't go on to use vaping or tobacco products? Population groups, I think we've already mentioned that we're looking at scoping out how we do that, specifically looking at smoking prevalence in pregnancy and a project around severe mental illness. We know that those 2 groups are a target area we want to concentrate on. and we want to look at the illegal sale of tobacco products, as I've already talked about. I'm going to stop there, and obviously if you've got questions, keep them in your mind. We're going to come back to those questions, but I'm going to hand you over to Julie.
Great, thank you. Right, okay. Okay then, so this priority is aligned with the Active Communities Framework that's been developed, which we brought to the EAP last time for discussion. So it's very much about not only developing, protecting and improving physical assets, but also give direction and vision for the service and programmes that support the community to be active. The strategy was developed collaboratively with a range of partners and representatives from the community. An Active Communities Partnership has now been established and had its first meeting. So the second one takes place next week. And this partnership will support the ongoing development of the actions and ensure they evolve and are delivered. So this partnership will continue to develop to ensure that we have all partners around the table that can impact on this area of work. The Keeping Active priority is embedded into this work from the Health and Wellbeing Strategy and will be overseen by the partnership. So actions are being developed using information gathered from the Active Community Strategy and will focus on 1 or 2 areas per objective. The next stage of the partnership is to develop some theme-focused working groups that will be able to work at more of a detailed level to deliver the actions. These will be responsible to and report back to the partnership meetings. The next slide. Okay, so the 4 themes are, as you can see, healthy communities, so improving health and well-being through the development and delivery of active well-being opportunities, increasing participation in physical activity and movement. Connecting communities, so connecting people and communities through this work to improve well-being and provide active well-being assets that communities across North Northamptonshire can be proud of. Thriving communities, this is about increased active well-being opportunities, contributing towards vibrant and safe communities and having increased opportunities for education, training and personal development. And green communities, so active travel, ensuring this is the easy choice for residents, and developments embrace active environments in design and vision. It also is around our parks and open spaces and ensures they are valued and accessible. And also it's about our physical assets and focusing on energy reduction and decarbonisation. On to the next one. So what we've done so far. So first, as mentioned, we have established the Active Communities Partnership. Key areas of work have been identified across the life course and a focus on reducing inequalities. The Active Communities Partnership will support the next stage of continuing to develop the action plan, as I mentioned. And as you can see from this slide, we have the themes with identified focus areas that will form part of the initial work within the working groups that we will establish. So Healthy Communities has 2 areas to focus on, so older people and families. For older people, we will look at how, by working together, we can expand opportunities to be active, supporting health, care and VCSE sectors to deliver an active ageing approach within their services. For families, this work will align closely with the children and young people's priority area within the Health and Wellbeing Strategy, and the NN Leisure Active Families Programme, funded by Public Health, will aim to support families to be active together, overcoming barriers to activity for opportunity and provision to be accessible in areas for those most in need. Connected Communities will be on the place-based inequalities. So this work will focus on developing the place-based programme supported at the moment by Sport England. For areas across North Northants, Sport England have recognised some areas of having low participation and activity levels, and they have been identified as Queensway, Kingswood and Lodge Park. Although these areas have been identified by Sport England, we also recognise there are other areas within North Northamptonshire that also need support, so programmes of work will aim to work across wider areas when possible. Thriving Communities focus will be workplaces. So this is about engagement with employers to support them to create healthy workplaces and support increased opportunities and knowledge for their employees' well-being. And then finally, Green Communities. The focus area will be active environments, so increasing the use of local green spaces and the Greenway. And the next one. So lots to focus on and progress. However, the future focus of each of these areas has been summarised on this slide. So healthy communities for older people, so scoping existing provision, ensuring we understand the needs of the different sectors involved in working with older people, and progression of the development of a test programme of work that will determine what works well to support the caring workforce, and communication strategies to increase movement and activity in older people. And then healthy communities for families. This will involve the continued implementation and development of the Active Families programme, and continue with community engagement to identify and address barriers for participation in each of the communities that we're working in. Connected communities, this is the place-based inequalities, so this work will gather information to fully understand the identified communities for the Sport England work. Some of these we have more information on than others. Again, test projects will be developed to understand what works well and what we can learn from these. This is the approach that Sport England require us to take, so we can develop a fully informed action plan and funding application to Sport England for initiatives to support these communities. Thriving communities, again, we need to understand current provision for support and who is involved and what is needed. We then need to develop a joined-up approach to supporting employers working with the Active Communities Partnership. And then green communities, so active environments. We need to understand what is already in place across North Northamptonshire, identify priority areas for expansion and development of the existing programmes, and ensure that information on local green spaces and programmes is easily accessible. Okay.
So moving on to the mental health and wellbeing section of this, you'd be glad to know that this is the area that I'm leading on. I'm not reading someone else's slides out for this one. So the programme approach is about improving public mental health. This is very much a partnership approach. Public health is responsible in part for some of it in terms of direct delivery, but in the main is an influencer and a supporter within this agenda. So there are multiple partners involved in the prevention of mental ill health, but our aim is to reduce that inequality across the whole of North Northamptonshire. So we've got 3 specific objectives. Again, as said, we're in partnership with other agencies. As part of this, we're not the lead organisation. So what we're looking at is strengthening and refining our approach to reduction of self-harm and suicide and prevention of suicide. We want to increase the focus on reducing smoking in people with severe mental illness and look at the opportunities to improve the physical health of people with severe mental illness. We're also looking at how that is an inequality within our system. So looking at how we reduce mental health related inequalities in terms of access, outcome and experience. Again, as I said, we're an influencer within some of this and we're a direct delivery. So there are a number of boards set up to deal with this and progress to date. There's been a suicide prevention strategy and action plan running for the last 3 years. It's due for refresh. Some of that will continue. There is a governance section on that which is sitting under the mental health, learning disability and autism pillar, which is a multifaceted partnership group. But there is an oversight from a suicide prevention steering group. We also have a post-prevention support package which has been developed to support schools in Northamptonshire, and we reviewed and updated that in November 2024. There is also the development of an all-age digital offer, which was commissioned through Shout. It's a 24/7 confidential support platform, and it's available to anybody in North Northamptonshire who is looking for support, immediate support with depression, anxiety or self-harm. The idea of that is that sometimes you can't get that with a physical place, particularly in the middle of the night if you're struggling. So actually having that 24/7 crisis support line was the thing that came out in research. There's also the development of training across the county. This is a North, Northants and West initiative, working in partnership with the West to develop training across our partner agencies and looking at how we support our delivery staff to be able to deal with those day-to-day issues around mental health first aid and mental health crisis. And we've also been looking at a system-wide protocol for notification of suspected suicides. We currently get information about people who have chosen to take their own life, but what we need as a system is to look at those people who were near miss, or we've fortunately been able to make an intervention before the act has taken place, and how we work with those people to make sure that they've got the support and wraparound services that they need. Action plan to progress is, we've certainly been looking at severe mental illness and the improvement of physical health in that group. We have a specifically commissioned health check system, which is aimed at making sure that that population has got targeted health checks like the rest of our population, and has access to the interventions that would prevent further ill health or the progression of ill health. We have a clinical lead looking at those with our public health colleagues, so we've got support with our smoking cessation services, again looking at universal targeting. So whilst that service is available to everybody in our community, actually we already know that there are pockets of society that struggle to access those services, so we want to make sure that that access is changed, and there's a targeted approach, so it's easier to access. We're also looking at inequalities, so we're looking at how those co-occurring inequalities happen, so people with severe mental illness but are also part of a minority group, or are homeless, or have issues with drugs and alcohol. We're also looking at how we do that based on data, so understanding our local needs. We're also looking at the social determinants, so where are those people living? We know that some people in our society will be affected more, and will have more difficulty in accessing the services that are traditionally provided, so we're really wanting to address those issues. And early identification through our health checks, and also then linking with our active leisure teams, our young people's teams, of how we can reduce unhealthy lifestyle behaviours earlier in the chain, and also then looking at how we can work with people who are already experiencing those lifestyle issues. How we're progressing. So the SMI maturity programme, as I said, the severe mental illness maturity programme is already underway. Those health checks are taking place. At the moment, we're waiting for that data to be released. We don't know yet whether that has had the impact that we intended, but we know based on the research we did prior to doing that programme that we expect that it will have an impact. Our clinical leads are looking at those pathways, outcome-based, so how many people came in for referral following a health check, how many people stayed in that engagement process, and how we're evaluating that service to make sure that if people are dropping out, why, how are we changing those services to meet that population demand, rather than thinking that actually the service isn't working and just shrugging about it. We're actually making real good headway into making sure those services meet the population's needs. And the targeted interventions from our smoking cessation teams. We're also looking at, as I said, those co-occurring conditions and how we can work better with our colleagues, and we've been focusing on those key areas. I'm now going to hand you over to Patsy, who's going to take on the slides around children and young people, and is our public health expert on those.
Okay, thank you. Thank you. So this is giving you an oversight of where we are with Healthy Weight in terms of the strategy. So Healthy Weight, as you may be well aware, is not only a local issue, it's a regional issue and a national issue. And in North Northants, as it says there, our latest data set tells us that our reception children, so that's children aged 4 to 5 year olds, we have 23.4% of them that are overweight or obese, which is statistically significantly higher than England. And in the same year, our children in year 6, which is age 10 to 11, we have 36.9% of those children who are overweight and obese. And that is statistically similar to England. So although we're similar, it's still far too high for what we should have. And then we talk about healthy weight, we look at the overweight and obese, but we also look at the underweight as well. We have a much smaller proportion of children in Northants that are underweight, so 1.2% of our reception children, which is age 4 to 5, and 1.1% of our year 6 children, which is 10 to 11. So both ends of the scales are as important as each other. So we need to think about how we provide interventions, provide access to our families and our children to improve those rates. So our aim overall is to reduce the prevalence of childhood obesity and reduce inequalities in childhood obesity between different population groups. Research and data tells us that not only is child obesity high, but also there's big differences between the different sections of the community as well. So whether it's ethnicity, boys and girls, and also those in deprived areas. So there's lots of, we have lots of data to kind of help us shape where we need to target services. So our objectives are to use the existing assets, as it says there, so really working in partnership, so with family hubs and our Healthy Schools programme. Healthy Schools are really embedded in our schools, and that's where the NCMP programme takes place, which is delivered by our provider service, which is NHFT. But there is close working going on with the Healthy Schools programme and family hubs, really to understand what's happening and look at how we can come up with some primary prevention to address this. The next thing we're going to do with work assisting partners, exploring opportunities for school and community-based family weight management. We've done lots of research around what is the most effective way to reduce childhood obesity. And there is no one single gold standard approach to doing it. So we have to work in a systems way. And we also have to work with families. Family weight management program are shown to be the most effective. But then that's working as families. What we need to think about is how do we bring that all together? Thinking about some of the work that Julie was talking about with the active partnerships and those kind of things. So, work to be done. The other area that we're going to focus on is recognising the association between childhood obesity and poor oral health. Oral health is a big issue for us as well, because if people are eating unhealthily, that not only are they putting on weight, but they're also, not doing anything to improve their oral health. And we know oral health has a knock-on effect for children, not being able to attend school, not being able to engage and socialise and all of those things. So that is a key part for us in thinking about how do we reduce the obesity. And it goes back to from infant feeding, weaning, all of those kind of things. We just need to start at the beginning to kind of embed those messages to families. And then the last one, as I've just mentioned, is dovetailing with keeping active priority work with partners. So there's lots of work going on, as we've heard earlier, around keeping families active and children and young people active. We just need to work out how do we encourage young people to participate in that. And it's not only sports like football, it's about physical activity. Lots of different ways we can work with people, young people, to keep them active. So there are 4 objectives that we'll be focusing on to bring this plan to life. The next one is, like I say, we're at the beginning. So this is an example of a program plan. So if we just take the oral health bit that I talked about earlier. So what we are doing so far is we have an aim to reduce dental caries and admissions to hospitals for teeth extractions. We have quite a high number of children going into hospitals for having teeth removed, and when they go in, it's not usually 1 tooth removed, it's like they're having 3 or 4 or 5 teeth removed. And not only that, we're having siblings in the same families going through the same process. So there's a lot of work to do around really supporting parents and educating them, communicating them positive messages around healthy eating. So one of the objectives that we've got on this strand of work is to ensure that professionals working with children and families communicate consistent messages regarding infant feeding, healthy weaning and healthy family diets. Like I say, if we can start at the beginning with those families, with the importance of all of those strands of work and the importance of baby teeth as well, because a lot of families think that it doesn't matter because you're going to get a new set of teeth anyway. But that's the wrong message. So we're working as a partnership to really come up with consistent messages that we can communicate to parents through all strands, so through schools, through communities, through family hubs, just so we get those messages across. Some of the activities that we're doing is we're developing oral health social marketing campaigns. So again, that's to promote the messages. We're going to undertake an audit on oral health practices in earlier settings. So really trying to understand, one, if they have a policy, and two, what is that policy saying? Are they supporting our objective to reduce sugars and salts and things like that in the foods that they're given to children, and the times of the day they're allowing children to have those sweet things. And then we're working with family hubs to finalise an infant feeding strategy and an action plan. So we've got a draft of the infant feeding strategy, and in there it will be talking about healthy eating, healthy weaning, all of the things that I've mentioned before. And then we've got the short-term, medium-term and long-term outcomes that we hope to achieve for each of those strands. I'm not going to read them out, but you can see them. They're there. And then, measuring progress at population level. So we have our public health indicators from Fingertips, and they're the ones that we use to measure where we're at in terms of Northants, but also they're used to measure where we're at compared to East Midlands and England, and we can measure against our statistical neighbours as well. And so you can see that's where we are currently. So we're at 23.4%, as I said earlier, and then we need to set ourselves some ambitions, and usually our ambitions would be at least to be as good as England, or as good as our statistical neighbours. So that's where we are. And on there's also the hospital admissions for dental caries, which I talked about before. So you can see where we are with that compared to England. So so that's kind of giving an overview of where we're at to with healthy weight for children and young people in Northants. Thank you. I shall hand
Thanks,
over
Patsy.
to who am I handed over to?
Well, it's Kerry, who's actually Hazel.
That's great. Thank you very much. As Shirley mentioned, this is one of the projects that's in its quite infancy stages compared to some of the other projects we've heard of today. We know that financial stability or lack of can have wide-ranging impacts to people's lives, communities and the wider economy. Data shows that 1 in 5 people in the UK live in poverty where they lack the financial resources to meet their needs. When people have financial resilience, they're able to manage day-to-day and cope with the unexpected, which can then lead to a positive effect, for example, on their health and well-being. The cost of living crisis has been affecting people since 2022, and the ONS data showed in August last year that it identified 86% of adults. The cost of living was the most important issue they faced. As mentioned previously, the impact of not having financial stability is wide-ranging. And as seen in the slide, those residents that are affected most are those asylum seekers, homelessness and rough sleepers, those in the care system, and also those in the criminal justice system. The main characteristics and circumstances that impact financial exclusion have been identified as lifestyle. So you can see those that are listed there, and they may be because it's short-term priorities or impulsive behaviours. And also financial and digital literacy, so limited knowledge on how to set up bank accounts or managing their own finances. So what's the local picture? So here in Northants, the 20 LSOAs are, not surprisingly, include Kingswood in Corby, Avondale Grange in Kettering, and Queensway and Hemingwell in Wellingborough. Child poverty is rising and impacting their health, and you've heard a little bit about that in some of the previous presentations. Job opportunities are high in urban areas, but data shows low educational attainment levels are the lowest in the most deprived neighbourhoods. Deprived neighbourhoods statistically have the highest level of social housing, and those in Wellingborough are within the highest 10% for that poverty, particularly for fuel poverty. And those eligible for free school meals at primary school are higher than the national average at 26.1%. Sorry, the next slide. Thank you. These are a number of activities that are helping to have a positive effect on that financial stability and resilience. We have advice agencies in North Northants who are seeing an increasing number of individuals accessing them for support. Agencies like Citizen Advice North Northants and SNN are helping individuals with benefit checks to ensure they claim the benefits they are entitled to. The council has also invested £110,000 per annum to Citizen Advice and Community Law Service for such advice. Alongside this, the council has been administrating the Household Support Fund with a wide range of support, with holiday food vouchers, financial and winter energy support, and alongside Northamptonshire Support have also been delivering the Holiday Activity Fund. So as we said, this project is in the early stages. We know what we're aiming to do and what we might achieve. The next stage is to co-produce the action plan with all our partners in the VCSE sector and critically with those with lived experience. Thank you.
Thank you. I think that's all the presentations. We've just put this slide up again, as Shirley said right at the beginning, just to remind you of the things we're asking our members to talk to us about. But I think I'm going to hand back to Shirley around questions.
Councillor Mercer, Chair, we're happy to take questions.
Yes, okay. A lot of information there, as you can see. Although there are 5 strands, they actually sort of overlap somewhat. So smoking, mental health, or children, young people, and active lives. You know, they're all, you know, they're strands on themselves, but actually they're you know, they interact with each other. So questions up there, you know, how can you help us? Perhaps if we take them one at a time, how can you connect better to your local community? Any ideas on that, Councillor McGee?
Just before we answer the questions, can I just have some clarification on some of it? Can I have an update on the Corby Hub, please, where we are at that, because that's important.
Do you mean the family hub?
The family hub, the Corby Family Hub. Are they all out and about?
I'm not sure we've got anyone here that can deal with the family hubs because we haven't got that department.
And another question, just so I can understand it better. When we say place, how low is that place? At what level does that mean?
When you say place, do you mean like... I think basically I would say, if it's me, that the laps, we've got the 7 laps. You know, there's one for Corby, and then there's 2 for East Northants, 2 for Kettering, and 2 for Wellingborough. And very much all this work is linked in with the laps. In fact, the laps I've been to, they had a lot of data breaking down. So, for instance, the obesity in children, it's broken down by those individual areas so that you can see a little bit more, you know, where it's perhaps higher in some than others. But I think, and also the labs in Corby have been working heavily with the smoking and vaping because that's an area that has particular problems.
Chair, I understand that, but to make a real difference, in my humble opinion, it's actually going into the communities, the estates, where the most problems are. And that's what I think is place-based, personally, and it's how we do that.
Going out into the community,
And, Chair, an update on the family hub in Corby, please.
Sorry, can you put the mic a bit nearer, because it's a little bit different.
And an update on the family hub in Corby, please. Is it up and running yet? Are we still there?
No, it's not running.
No.
Aye, thanks, Chair. We'll bring you an update on the Family Hub in Corby on progress on that. But just to clarify, the Councillor Mercer's right. A lot of this activity is at LAP level, but obviously within the LAPs you have smaller communities, and certainly the Sport England activity is what I would call hyper-local, so it is within estates. Councillor McGee, whilst the starting process is around LAPs, where the inequality is identified, and that's part of the process of developing the action plans and making sure where we identify that there is higher need, that's our focus of activity. But it's not to exclude the rest of the area. But certainly the place-based agenda starts at the LAP level, but some of the projects are focused at a much more local level.
I'm a bit prelapsed about why I can't get an update on the Corby Family Hub. Most of them are all up and running for some time now, and it's not even in place yet.
The Rushton one is not up and running at the East Northants one. But they are working on them, I know. So, I mean, we were going to have a meeting last week, I think, but because there's some new money come from the government at the moment, I think they're starting to sort of sort out what the priorities are and where the work's going. So there is movement, but it's on the physical hubs. There is also the digital offer as well, the front door, so that people can get help through that. But certainly the Kettering, Wellingborough hubs are up and running. Councillor Marks.
Yes, thank you, Madam Chairman. Certainly from Kettering point of view, specifically Avondale Grange, the Kettering East LAP, Local Area Partnership, is very important, both for the poverty, deprivation and social problems in Avondale Grange and adjacent to it, because you can't always just draw a neat line. People don't necessarily live within that line. So having the larger area is a genuine help. But of course, we meet in those community centres in Avondale Grange. But there are problems outside there too. Thank you.
There are also not necessarily, the identified areas, the three that were previously part of the Levelling Up. One of the latest laps that I went to for East Northants South, there are 3 different areas identified with smaller pockets of deprivation, 2 in Rushton and 1 in Irthlingborough. And interestingly, they're the same 3 that East Northants Council identified some years ago and we worked on. So we're going to revisit that information and see what can be done in those much smaller areas. So I think it starts in LAPs, but with the LAPs, what they started out with is the agencies bringing people together, but the idea is to go actually get the individuals, the communities in. Once they've worked out what they're supposed to be doing, where they want to do it, where the focus is, what the priorities are, then actually go out or get people to come into the LAPs to work with the population individually. Yep. Did you want to come back? No. Right. So, and there's where better area. There's a specific groups we're linking to, and any specific approaches you think might be successful. I would say, first of all, the one with the shout. Very important that there is that service, but does anyone know about it? It's really shouting about it, if you pardon the pun. I know there are lots of different sort of agencies that work in that area. There's a single number that you can phone, but if you're in crisis, how will you know to go to that?
So Shout was commissioned in September. It's when we finally signed off for Shout. And with the keyword partnership we do have marketing materials. So as a team, we're actually in the process of trying to disseminate those marketing materials. And we're also going to use the Children's Mental Health Week coming up next week, because they're going to different localities and different libraries across the county. So the children's Healthy Schools team will take those materials with them, and also we're going to use job centres, libraries and any community areas to make sure that they have these marketing materials. So as a team, it's something that we are working on to make sure that Shout is shouted about. So we're working on.
And I presume social media, because that's where...
Yes, so our county pages as well, and we have like email signatures as well, so to make sure that we have them on our social media pages as well.
That's where most younger people, especially, and older people now get all their information. So, yeah. Any other sort of... Yes, Councillor McGee.
Yeah, I mean, as for the first one, it's a very good question, and councillors do know the local areas, and all the organisations will hopefully councillors all know what's happening in their areas. And it'd be a good one to send out to all councillors and then get all that feedback rather than just two sitting here. But I'm a great believer that we shouldn't be expecting people to come to us. Where there's already groups running, where they're doing their own stuff, we should be piggybacking on that, turning up there and working with them. The Kingswood Cooperative that runs the Kingswood Centre, runs more than the Kingswood Centre. They do a lot of good work, and Julie knows that with sports, Northamptonshire too. There's a lot going on in that centre, and we should be pigtailing on what's actually happening rather than doing something new. The Beanfield Centre the Beanfield Community Centre do a lot of different stuff up there, and working with them would be a great opportunity, because we have the high prevalences both in Kingswood and Hazellease and in Beanfield. And the other one is the community shed. Some of you shall know the community shed down at Hazellease. They have people coming in with all sorts of arts and crafts, a wonderful group, and you just have to go down there and see the people standing outside smoking. It's a great place to go to and say, how can we help you? And the other one is, because we do a surgery there one Friday a month, is the Beanfield Food Bank. And we hold a surgery so that the people come in there obviously have problems, mental health problems, a lot of them are smokers, etc. And we just sit at the side and see if anybody wants to talk to us. Maybe that's an opportunity. We have somebody there now and again just to do things like that at the food banks, instead of them coming to us. And the biggest one for me, and it's not been mentioned, is you only have to go into the town centre and look at the people standing outside the pubs there who are smoking. How do we actually get them? Because that's the ones that are very difficult to get, and I'm not sure how we do that. But that's where you'll see most of the people and most of the local pubs in any town or in Northamptonshire. But that's the first question, Chair, if the other councillor wants to come in.
Yes, certainly.
Thank you, Councillor McGee. That's really useful, and that's the sort of signposting we want, because we don't always know where these groups are, and particularly if they're hyper-local, and they may not be on our radar. And I think accessing those groups and going to those groups is exactly what these action plans and development plans are about. The high-level strategy sits there and guides us, but actually what we want is to get out there, do the doing and see that real impact. So that's really, really useful. Thank you.
Councillor Marks, did you want to?
Yes, I mean, there are some groups we do neglect a bit. There's the church groups, for example, we could get more involved with. They come to us when they want things like new toilets and things like that, but they could be more active and involved with us in cooperative working, at least in my opinion.
It's probably easier when you've got these community centres, as Councillor McGee said, to go to them and they're there. It's more difficult in some of our areas, as I was discussing with Councillor McGee yesterday, where we don't have community centres. But there are probably other groups, as Councillor Mark said, church groups, different, there's lots of things like U3A, that have lots of different groups of gardening, singing, all sorts of things, and maybe sort of go into some of those groups. There's some of the charities as well, like Rotary and Round Table and various people like that get people together, and maybe that's quite a good source to actually go and find a group of people that are meeting together. Because obviously that's easier than getting to people individually, is getting to groups. Specific groups is a little bit more difficult, because they're called the hard to reach groups, so they're hard to reach. I think when we had the family days with the sports, that was absolutely excellent because you had people from all over the community coming there. And for free sports for young people, it was really good. And you could get to speak to a lot of people. And there were also different agencies there that people could go up and see the stall. And there are other community events like that. Like, I mean, Rushden, we have Party in the Park. We have thousands of people come to it. And we have lots of different stalls, which, you know, for community groups, charities, etc. It'd be quite useful to go out to those sort of things. And I'm sure other areas have fairs and fetes and as well. So that might be, you know, Christmas fair or, you know, other organisations that organise get-togethers and that sort of thing. But you know, that's where people are in a bit more numbers rather than, you know, just getting to meet them individually. Yeah, Councillor Gay.
Chair, thank you. Can I just touch on some of this presentation, if I may? And first, I'd like to say there's some excellent work going on across there, isn't there? It's fantastic to see, and you can see that there's a lot of work going on and will progress, and that's great to see. We really do appreciate that. There's a couple of things that perturbed me, Chair, about how do we reduce these vaping shops? You only have to go over to most towns, and there's so many vaping shops, and that encourages people rather than. And so we've got to be strong at planning and etc. to say, no, we've got enough of them, we don't need any more. And it's so hard to police it. I recognise that because they are a lot, and you can see young people coming in and out of them, and it is worrying. We mentioned about how to stop people, and I think we're doing a good job in smoking cessation in Corby and Northants. Is there a chance, and I know some of the older people that I go and visit, etc., they were talking about medication for that, and I know that that's available to some people, but not everybody. How does that work? I'm not really sure, because one of my older person asked me the other day about that. And I think you have to go through your GPs, etc., if you want to do that, and it depends on your own health. The Keeping Active, who are the partners in the Keeping Active one? Just a rough idea of who the partners are. And when we're trying to keep older people active, for the West Glebe Centre, for example, somebody that runs the adult football stopped me I think it was yesterday actually. He said, why are we getting charged a 33% rise to use the hall? I mean, that goes against everything we're trying to do if we make a 33% rise for usage of a hall. It just goes against everything that this strategy is trying to do, so maybe I can get a better understanding of that. What work are we doing with the biggest companies in Corby? Because, you know, people at RS, Down the Works, etc., it's so important that we tap into them and see if they work with us so we can go in and talk to people. I think that's extremely important. And my final one, Chair, because I don't want to take all the time. Shout seems an excellent organisation. How do we measure that success? What is the outcomes for us from that? And it must be quite hard to measure that, I imagine, but there must be some sort of outcomes that we are looking to get from that. Thank you, Chair.
Thank you. So, would like to pick up the answers to each of those questions? Lee?
Lee, are you happy to do the vaping and planning?
Try my best. Yeah. As I said at the beginning, it's not the area that I'm specifically working in, but I do know quite a lot about it. So as I talked about on the presentation, there's been a significant amount of investment into trading standards and a partnership approach between trading standards, public health, police, of targeting particularly vape shops that are working outside of the legislation, and specifically around underage sales. It's been a largely successful project, and I haven't got the numbers in my head, but I do know that it was significant numbers of seizures, and that's an ongoing project. It will continue, and it's based on intelligence. So if there is intelligence from any councillors, trading standards want it. You're closest to those populations, and residents tell us things. So it's useful to know, because obviously then a targeted approach can be taken, and point of sale testing. with our young people. And the other piece of work that we have officers that are specifically understanding our planning, not our town planning, but the planning of licensing, what planning permissions different properties have, what they're allowed to do in those properties. We're slightly hampered by national policy and what the legislation tells us, but there is work going on about how we can reduce the number of premises that are, the number of premises.
And just to add that, Lee's right, and one of the benefits of Lee joining us is we have that capacity at the right level to start influencing planning policy and planning for the future and influencing how we want to shape North Northants in the future and what we value and what we value less. And I think the other thing I would add with the Trading Standards Project is there are early conversations looking at how we can use the Proceeds of Crime Act to continue to fund activity. Those are early discussions we've had with our colleagues in regulatory services. So there's a real ambition to make that self-sustaining because, as Lee said, it's actually been really, really successful.
I think with the vaping as well, it's a national issue, and I know the government, the previous government and this government are both trying to do a lot in that area. And I think one of the main things they could do is to, where cigarettes used to be put behind displays, hidden away, the vapes are out on the counter apparently, and look like sweets, and apparently very attractive to young people. So to push for some sort of impediment to people seeing and advertising these vapes will be very useful from that point of view. There was some other questions there apart from the smoking. Julie, were there some things that you could pick up?
Sorry, I was just quickly trying to find the membership list of the active communities. I think there's so many on there. I've just got it. Right.
Julie, if it's a lot.
Yeah, there's a bit. I mean, we have recognised there are still some gaps there, and we are still trying to chase people to find the right person to come to the meetings. So just looking at, there's obviously quite a few from the council across all the different directorates. So children's services, adult social care, public health. We've got NSport on there. We've got assets and environment as well, because obviously it's about planning policies and things. We've got tourism there. Backup CICs on there. We've got Freedom Leisure, Places Leisure, Kettering Leisure Village, LNC Children's Services, Primary Care's on there, Groundwork, Sport Northamptonshire, Service 6, Age UK, Family Hubs there, Youth Works, GPA Alliance, Schools Brightways, GPs, Healthy Schools, Adult Social Care, Children's Trust, ICB again, Health Watch. So lots on there. I can send it through to you.
Yeah. Councillor Howell and myself are on it as well,
yes.
So we're sort of trying to make sure that some of that information comes back to councillors. Yeah, Councillor Marks.
Thank you, Madam Chairman. With my planning hat on, there are some tools we can use, but we have to be very careful that we're not overturned on appeal, because it's not just the matter of expense, because we're paying the legal fees. If we get a reputation of being overturned on appeal, we lose our authority over planning completely. So we have to be careful which battles we fight. But there are some tools we can use. They do exist.
There was a question about Shout. Would you like to take that?
Yes, so with the package that we commissioned for Shout, it comes with a quarterly insight report. So we get a quarterly review from them, and I just opened the one that we got in December, which was our first one. I'll just mention some of the highlights from it. So we had 128 conversations in total, with 22 of those being repeat conversations and 3 active rescues. And they explain that with active rescues is when they feel like someone is in a place of crisis, so they have to send emergency services, police, ambulance to them during that conversation. So keeping them in the conversation and making sure that someone is there to help them. So with the insight reports, we do get how many conversations are there, time of day, the days, when the conversation happens, and like the key issues as well. We don't get demographic data because it is a confidential service. So people can give their demographic data if they want to, but because of that confidentiality, we don't really get any of that.
So, was that all your questions, Councillor?
I do have another couple, if I may, Chair.
That's right.
I'm targeting the keeping active side of it. You mentioned families and how you can support them. How do we identify the families, and how, when you mean support them, is it free, is it subsidised? How are we going to do that? And the other question, I think it's more of a statement, but targeting the super output areas is where we can make a real difference and bring the figures dramatically down if we do it right. The difficulty I've experienced in my many years doing this is that other councils, departments always say it's not fair, it's that area again. But if we don't make a difference in that area, the targets don't really change. And I think other councils, and I know there's problems in every area and you have pockets, but targeting the super output areas without people saying, oh, we shouldn't be doing that, what about my area? They've got to realise it can make a big difference if we really do that, and then take that good practice out elsewhere. And I always think that's a difficult one to get everyone to understand.
Yeah, I think it's probably just a...
Thanks, Councillor McGee. Yeah, we are aware of the communities that we need to be working in, and we've got teams at the moment we've just recruited this year that are going out into those communities, getting to meet people, whether it's in the local shops, outside local schools, talking to the schools, community centres as well. So they are, in the community, and that's important to do that. It's not just to sit up in an office somewhere and say, oh, this is where we're going to work. It's getting in there, getting to know the people, and getting to know the existing groups in that area, because what we don't want to do is go in and tread on people's toes. We want to work with people and support people to expand their services and see what we can do to support that. So when we're saying to make it accessible, so it's in their area, so it's not somewhere they have to travel to. Many times the Active Families Project, for example, is free, so they can come in a local park or area. If we have to go into a community centre, whether there's a charge that's implemented on us to hire that, obviously may have an impact on whether it's a low-cost activity we need to pay for. But the funding is there for the workers to deliver those programmes and work with existing groups in that community to help develop their skills, their training. It may be that there's some people interested in dance, for example, that want to do some dance leader qualifications. We can provide that for them to then support them in their community to do that themselves. So there's all sorts of things we can do. And the same with sports leaders qualifications, but it's not just about sport. It is about just moving more. The Wellbeing Walks programme, for example, we're mapping at the moment where that's being delivered and target those areas where there's gaps. And we'll work in those communities to develop groups, whether it's buggy walks, whether it's just a general walk, wellbeing walk for people to get together, but also have that social interaction there as well, and make it into a social group.
I think Councillor McGee also mentioned about companies like RS and other big companies, and I just think that was with the smoking particularly a big focus to get them on board, but also with the active time to take exercise and various other sort of activities. So big companies would be something. And the other, I wasn't sure quite what was happening with the smoking pregnancy, whether work's done with presumably health visitors, with midwives, etc., and the hospitals to obviously explain the dangers, etc.
Yeah, Holly can pick that.
Thank you, Chair. Yeah, so we, as part of our expansion of the team, we've now got 2 specialists within the team, one of which will be focusing on pregnancy and that wider family as well. So we appreciate it's not just the pregnant women that can impact, it's also looking at smoke-free homes. So we're working with our CYP team, so with Patsy, and with our specialist and team leader to look at how we can really sort of understand that group of people. So we know that the data isn't probably accurate to the number of smokers that are out there who are pregnant. So we need to understand why are they not engaging in the service and try to break down some of that stigma. So that's going to be our next piece of work, and building that project plan to look into it.
Okay. Patsy, did you want to...
Yeah, just to say that as part of the smoking pregnancy work, as part of the work that kind of I lead on with the stop smoking service from ICB point of view. So as the LMNS, we have it as a priority work stream to reduce the number of pregnant smokers. And so within the maternity services, they have tobacco dependency advisors who are, they work within the maternity services, but specifically around stop smoking. So they provide support to the women, and that's the intense support. And they've been trained through the stop smoking service to provide that. So we have got kind of a real good partnership going to support pregnant women. And then from a public health perspective, we are looking at the preconception. So we want to do some work. I've not spoken to you about this yet, Harley, but some work around targeting childbearing age women. So communicating the messages to them to prepare themselves for pregnancy. So trying to get them to quit before 12 months before they're pregnant, so they don't become pregnant smokers. So that's work that is going on from a public health perspective.
And having attended the session this week on alcohol and the dangers of drinking while pregnant
alcohol.
as well.
Yeah.
You know, I know it's not one of our strands, but you know, if you're talking to women anyway, you know, that age or just recently found out they're pregnant, then you know that's another message that we need to get across, is that no alcohol is safe.
Yeah,
Yeah.
That's one of the strands of our healthy pregnancy. So
Okay.
we're thinking about alcohol, smoking, physical activity, healthy eating, all of those things. The idea is to work with childbearing age women to get themselves ready for pregnancy. Yeah,
That's good.
thank you.
Yeah, Councillor McGee.
Forgive me if I'm asking a lot of questions, but it's
Well,
extremely interesting stuff.
not
And it's
a lot of
important
us.
to try and get it right, I think. What I haven't heard mentioned is that partnerships with housing. We know people that live in difficult housing situations, such as HMOs, etc., are more prevalent to maybe mental health or difficulties. Are we working with the bigger HMOs or doing anything with them? And I think housing is a key partner to a lot of this, in my humble opinion. And when we talk about the obesity problem with our children, I see some of these schools, they have excellent sports facilities, but they're not open at weekends for anybody to use, etc. Isn't that a great shame? Because they put a lot of funding into that. And we don't have a say, unfortunately. Schools are privatised, unfortunately, nowadays. But we need to be working with these schools so that these places are open at weekends so our young people can get an opportunity to use them. And that would be a big difference to them. And one more thing, and then I'll stop altogether, Chair. Can we ask, you know, this whole thing to come back in 6 months, 12 months or something and say, what have we actually achieved? Because that would be extremely important to know.
I'm sure that'd be okay, yeah.
Yeah, through you, Chair. Yeah, that's absolutely no problem, and actually we would like to come back because it helps hold us to account. And as I said at the very beginning, these are iterative action plans, so where we find things working, we want to really capitalise on that, and where things are working less well, we will change tact, as it were, because these are very active plans. So coming back in, say, 12 months when our plans are either well underway or fully developed and being implemented would be really useful to us. So absolutely not a problem. And I think the comment about housing, yes, we have connections to housing, mostly at the severe end through the homelessness team, but obviously we will think about that in through the work strands as well. So thank you.
Did you want to say? Yeah. David,
Yeah, we certainly have some dedicated staff within tenancy support that focus on some of these health and wellbeing issues, particularly around things like financial resilience, mental health, those sorts of activities. We are exploring other ways of doing that as well, particularly around improving the digital office so that people can find information, because at the moment our web pages are not really great around that sort of housing support. So there's a couple of pieces of work in the pipeline which are going to focus on that moving forward. And we're just doing some due diligence around potentially working with some organisations that have some government funding around pushing the right sort of information out, which will focus on our own tenants within our council housing property as a starting point.
thank you, that's very useful. One of the strands was the oral health as well. I mean, that it's the figures I thought were staggering in the report of the number of young people going to hospital with dental problems. I mean, do you work with dentists as well? Patsy, that was your area, wasn't it?
Yeah, so we have a Northamptonshire Oral Health Alliance, and we have the dentist committee sitting on there. So somebody from the dental committee sits on there. So we don't have all the dentists around the table, but somebody who takes the messages back. And it's a good alliance, really, because that brings, we have partners around there. So we have specialist dentists around the table, as well as, you know, the non-specialists and public health and ICB, all the different people around the table. And as we know, there's a big issue around access to dental services at the moment. So what we're trying to do is really push out messages around, you know, consistent messages around what people should do to look after their health, their teeth in the first place. And that's what I say. So to parents, so what they should be doing for their children from the time they're weaning, looking after baby teeth, looking after, you know, going, you know, brushing twice a day, changing the toothbrush. So all the things that people are in control of, that you can be in control of, we're trying to push those messages. And then we are working with ICB through NHS England around what is it that dental practices are being supported to do. So they used to have this thing called checks. Babies should be checked by the 1 year check, but since COVID, that's kind of, they've not really pushed that with dental practices because the access to dental services has been so poor. So it's things around the level of fluoride they should be using on their toothbrushes as well, and just really get the message about that fluoride is, you know, you don't have to buy the top brand toothpaste to get the fluoride that you need. So it's just kind of keeping things as basic as possible, just to make sure that parents know the importance of brushing their teeth, knowing the importance of everybody having their own toothbrush, knowing they should be doing it twice a day, reduce the amount of sugar, you know, having water and milk instead of, you know, all those messages. So we are working with, the dentists, and we're hearing, you know, their frustrations as dentists as well. So from a public health perspective, the best we can do is make sure that messages are consistent, people know how to access information, and we can support them. And we are doing things like with the food banks as well. So we've started to distribute children's toothbrushes and toothbrush packs and adults' toothbrush packs as well through food banks. So people coming to food bank for supplies are also getting access to the toothbrushes and that. And we provide some training as well. So there's a lot of work going on. It's just keeping it consistent.
Yeah.
and
Marks.
Yes, thank you. On the point about diet and teeth, of course the teeth are very important and jaw is very important, but also the high sugar diet and the poor diets in other ways lead straight on to diabetes. And diabetes, as you get older, is a vicious disease. And I think a lot of young people don't realise that they're on the road to diabetes. And that's something we need to get over to.
Yeah, thank you. Yeah. Oh, yeah. Sorry, Lee.
So I'm just going to pick up on one of the things that you asked earlier. I've missed my chance. So two things around prevention of obesity in longer term. So one of the things that I came in with is around the local plan of how we develop our cities, towns that automatically afford exercise. So making those things easy within our planning system. So healthy spaces, looking at how we plan our parks, how we plan our strategic builds, and how, for instance, just one initiative of how do people who live in a new build walk to school. So making sure that we've got those walking routes and that those routes are well lit, that they're useful for people with a buggy or a wheelchair, that actually it's easier to walk to school and it's safer than getting a car out. So doing things like that within our local plan, and I know there's a massive amount of work going into that, health impact assessments within our new builds. But also, I mean, I walked through the park at the side today because I couldn't park in the main car park, and all through there is exercise equipment, which is brilliant because that means that we don't need to rely on sports, formal sports, that actually we're making it easy for our residents to be able to go in and do some exercise really informally. Because quite a lot of people don't find it really easy to walk into a swimming bath that's very full or go into a sports team that actually exercises beyond sport. So that's just one of the initiatives that Public Health are involved in at the moment around that development of our local plan strategy.
No, sorry. Yes, Jodie, you were going to come in.
I was just going to mention about the schools facilities. We've just recently had our leisure facility strategy done, and it has been identified in that, which we knew, that there are a number of facilities across North Northamptonshire where access for the community is limited and there's no community use agreement in place. But what we're doing at the moment, working with our planning colleagues, there's a number of secondary school and primary schools being built at Hamwood Park, for example. There will be community use agreements put in there before they are built, so it's getting in at that early stage to make sure that when they are built we do have access to them, and then those that aren't currently accessible and somewhere in the past and since COVID or whatever they've changed their minds and haven't reopened, we do need to target those, and that is something we hope to do in the future, just to bring them back online and open them back up for the community.
And with the local plan, another strand that has been mentioned is the prevalence of fast food outlets near to educational establishments. It's a tricky subject, but I think it's something that needs to be looked at, really. So, yeah.
And certainly there's been national initiatives on that and national policy which will assist us in doing that locally.
Oh, good. Yeah. On the financial resilience, one of the things I thought when I saw the slides is you said something like access to banks. That is difficult because the banks are gradually withdrawing from the high streets and actually trying to get banks to actually allow you to open an account. I have had many hours trying to sort out bank accounts recently, and they really need to get their act together so that people want to, to look after their money and, be able to do their daily business and things like that. And, just not necessarily people that are in financial problems, but just anyone. It's really difficult to do things with banks these days. And the post office is actually much better, actually, if people use that. That's a much better resource. So, yeah, Councillor Marks.
Yeah, absolutely, Madam Chairman. In Lloyd's in Kettering is gone, so I went to Wellingborough and was told, oh, you could have gone to Kettering Post Office. Well, it'd have been nice of them to tell me that. As for clubs and societies, you try and encourage local people to join clubs and societies, and then they come back and tell you they can't get a bank account because the local twinning society or the local library society or whatever is treated as if it was a terrorist group. And I don't know if this is the anti whatever laws at national or international level, but it is just plain stupid. It really is.
Yes, mine was actually a twinning society that I was trying to organise a bank account for. Yeah, Councillor McGee.
Thank you, Chair. And that work on the local plan is excellent. I think it's so important going forward, and it's so good to hear that. And when we're putting exercise equipment in, and when I go my walks, as I try to do regularly, going through down to Little Stanion, they've got excellent equipment there, and when I'm walking, especially in the summer, it's well used. And I'd love to see that sort of thing in more of our poorer estates, because we did go through that little bit of putting exercise stuff for older people in, and we've got it in Exeter Estate, we've got it in Kingswood. I've never seen any of it used. So we've got to look careful about what is being used and what's not when we move forward. And it was a shame because we helped get the funding for all that stuff, and it's just sitting there, and that's a great shame. The other one you're talking about, people's health and well-being, about access to banks or actually paying stuff. Unfortunately, we're closing our cash counter, and I know at least a handful of older people who love to walk up on a Monday morning, pay their rent, etc. And that's part of their well-being. They're getting out, they're doing something, they pop into town, they go home again, maybe on the bus. And it's a great shame we're closing it. I'd still love to see it, even if it was just an hour or something on a Monday morning, so that people still got that access. Because not everybody wants to do things online. And we shouldn't be forcing some people because they just don't want to do it.
Yeah. Shelley.
Councillor McGee, your point is well made about equipment that we've put in that's not well used, and I know Julie's quite keen to make sure that we use the facilities that we have, so you know that can be incorporated into action plans, that some of that local community activity is about both, I suppose, supporting people to use the equipment correctly but feeling confident to use it. So yes, those are the sorts of thoughts and suggestions. If you know there's activity facilities that aren't well used, we'd welcome knowing about that.
And I'd also say that working with the town and parish councils was very important as well. Certainly in East Northants, the town councils actually usually run the parks or maintain or install new equipment. So working with them, you know, very keen to you know, get people using that equipment. But you know, everywhere I think, you know, the parish councils are, you know, right on the ground level, and they know a lot of their population much closer than, you know, people at this level. So and perhaps working with NCALC as well, because they have access to an acre as well, have access to lots of parish councils, and they have magazines as well. They can get information out. So if there are, you know, open days, you know, your family fun days, etc., you know, I'm sure they would be really only too willing to help advertise those activities. So yeah. Any other points on any of the other? I think we've covered quite a lot, really. You know, as Councillor McGee said, you know, it's ongoing. So to come back in 12 months, really, really good. Because, I mean, he said 6 months. Whether you can manage 6 months or not, I don't know. But you know, because all of these, I'm sure, are going to develop over time. And I was just going to reiterate, it's a 5-year strategy, although I think Shirley said that the majority of the work will be done in the first 3 years, because then you'll probably be looking to, you know, refresh for a new sort of extension after that. But it all takes time. There's you know, an awful lot of work going on in each of the work streams, and I think a lot of things that you know, need time to develop and time to bring to fruition. But if, you know, as new ideas come up, there'll be new streams to work in. But if you can't do everything at once, which is what we started out, we had smoking and vaping came to the Health and Wellbeing Board first, and then the keeping active, etc. And so gradually having one as the main focus, with the others as, you know, what was going on in them. And so those Health and Wellbeing Boards are you know, useful to because they the Health and Wellbeing strategy comes back to there as well. So you know, keep an eye on that. Yeah.
Say one thing, I think it's so important, as Shirley said, about the flexibility and be able to change things if it's not working. That's so important. But when we're coming back and re-looking at it, it's about celebrating the success as well as saying what's changed and what's not. And I think that's just as important.
Yeah, and I think getting that message out there as well about what, you know, what the whole strategy is, all the strands and the achievements, the outcomes. So like you were saying with Shout is, you know, what are the outcomes, but there's all the others as well. And each of those individual strands, I mean, there's so many of them in all 5 of the major strands that, you know, we need to get the message out there. You know, this is an achievement, you know, where we've reached a milestone or whatever. So, you know, that'd be really good. Any other comments anyone would like to make? I think, you know, we've given that a good airing. and you know, really congratulate you on the work done so far, and you know, do keep us informed of where you get to in the future. Thank you. Moving on the agenda, we have next the agenda planning. My machine's gone to sleep. Right, I can't find it at the moment. What's that? Was it
Sorry,
on?
Chair, if I could just
Yeah.
say the executive forward plan has been superseded since the agenda was actually printed off. So I'll send out the newer one when we get back upstairs. And this is the last EAP active communities of this particular financial year. So we need to look at moving forward with some items for the next forward plan.
Right, okay. So, you know, obviously, as if it's the last one, you know, we're just putting forward ideas for future committee. So if anyone's got any particular thoughts of things that, I mean, mostly we look at what's coming on the executive forward plan, have a look and see if there's any items there that we need to feed into. There have been some big strategies this year with the active communities, the health and wellbeing, etc. So there's a big ticket items, but I'm sure there will be other things that will be coming forward as well that members would like to look at. So if there's nothing specific at the moment that we, you know, need to point out, then, you know, I'm sure that if members, you know, pass on their thoughts to the officer, and I'll put them on as possible for the agenda for next period. Okay. I don't think perhaps somebody's coming to turn off the microphone at some point. But if that's... I've got the agenda. So thank you very much for your attendance, and hope to see you next EAP, possibly.